So wonderful. Welcome, everyone. My name is Josie Keitel. I'm from Yoga for Cancer, and we are going to have a special, we've scheduled a special Q&A session with Tari. Tari Prinster is in the panel here, and as well as Claudia, which I'll give you a second in a few minutes. The purpose of this webinar was came out of a successful 5-hour course that we launched earlier this summer with Give Back Yoga University. And we were getting tons of questions that came through. And so we wanted to have a bespoke session to answer a lot of those questions, to dig deeper into the concept of oncology yoga. And at first we were like, hey, let's just use it for the people who've taken the course. And then we were like, wait, why would we want to limit that learning process and that opportunity? So we actually opened it up to anyone that was interested. And so therefore, we have had over 100 people register for the webinar today. And the purpose of this is to go through the questions that were submitted. Now, full disclosure, if we went through every question, you guys would be on a probably several week webinar. We were overwhelmed by the volume of questions and the way that we would need to answer those comprehensively. It would take hours and weeks. So we want to manage your time and our time properly. And we are going to, we've consolidated them. We've kind of merged them together. But also, this is just the start of the learning process. The reality is, the way that we think about it is you never stop learning around oncology yoga or learning, period. But oncology yoga is changing and evolving as much as the protocols for cancer are changing and evolving, as much as the research is mounting on the evidence, and more important, we are learning from clinical experience about how it's being applied in hospitals and cancer centers worldwide, and how that is having an impact on the quality of life. So today is just the start of your journey. And at the end, we will give an opportunity to ask any questions of people who are live. And then the most important thing is that you're going to get an email after this as with a follow-up of lots of additional information. So if we weren't able to address your question, we are going to give that to you in a follow-up email. And then very importantly, what we want to do, and I'm not going to hide this goal, is that we really want you to encourage additional trainings and additional opportunities. And there's 2 courses that we have on option right now is the 5-hour course that we partnered with Give Back Yoga on, that this came out of. And then we also have our 75-hour certificate program. And again, we're going to send you tons of information about details about that, and you can read that, I think. But today is really about getting in deep about those questions. So I kind of given the rough plan of attack. I am going to, my name is Josie Keitel, and I think I've introduced myself. I am the executive director, and I basically make stuff happen in the wonderful world of Yoga for Cancer. And I want to introduce first Claudia. Claudia, you want to introduce yourself?
Thank you, Josie. It's an honor to be here. My name is Claudia Cavazza, and I'm Director of Interdisciplinary Education for the Give Back Yoga Foundation. And Give Back Yoga Foundation's mission is to bring yoga to population in need who may not have access to it. And I was incredibly fortunate to meet both Tari and Josie in person last year. As part of our educational program, we got together with some of our partners' organization to film some short courses for yoga specialized for certain groups. And I, like I said, met Josie and Tari, and I learned a lot during the filming of the short course Oncology Yoga. So it was an incredible learning experience for myself. A reminder that what I do is important. Continuing learning as a yoga teacher as well is incredibly important. And so I feel very fortunate to be in this space and sharing all this knowledge with all of you.
Thank you. Welcome. And we're excited to have you involved in our Q&A today. And then the star of the show, Tari.
Hi, everyone. I'm not so sure I'm a star, but I certainly am very, very proud of the programs that we have created, or and that I started more than 23 years ago when I was diagnosed with cancer, because there was nothing around at that time that supported my recovery, and was a form of yoga, which I was doing a lot at the time and wanted to continue doing as a survivor. But no, there was very little information about what yoga could do for me undergoing treatments and what it does for me now as a survivor. So that's a long time ago. A lot has changed and a lot has evolved. And I'm so happy to see all of you here curious about the programs that we have created and how yoga for cancer has evolved. So thank you for joining us.
Great. Now, as I mentioned earlier, we're going to get stuck in. We're going to get straight into questions, and we're going to piggyback a little bit about who asks Tari, and then I'm going to answer a few to give Tari a break. So, Claudia, get us going. I think you have the first one.
Yes, I do. And it's question is close to my heart, because as a yoga teacher, again, not knowing who might be in my audience, I need to be prepared in a way that my yoga teacher training doesn't allow me to be, to work with specialized groups with specific needs. So I would like to ask Tari, how is oncology yoga different than what we define as normal yoga?
Normal yoga. Well, what is that by any measure? Well, the difference between normal yoga and oncology yoga is simple, very simple. Oncology yoga is specifically designed for the needs, risks, and challenges faced by someone who is either currently undergoing cancer treatments or has in the past. It is a comprehensive practice drawing on many, many yoga lineages to manage the side effects of treatments and also support daily functioning. So that's it in a tiny little simple nutshell.
Thank you, Tari. And again, as I mentioned, teaching all level classes, right? I might not know who is in the class, what specific needs my student may have. So according to your expertise, what are the top 3 modifications that should be made in all levels yoga classes for individuals with cancer?
Top 3 modifications. Wow. That's actually an impossible question to answer, because you, me, whoever asked the question, we do not know what the particular person in front of us, what their needs are, what they're dealing with, and also what they want from the yoga. So I would answer the question by saying, first of all, oncology yoga is not codified. In other words, there are not a specific formula. We have to use what is called critical thinking as applied to the individuals in front of us who come to us for our help and who come for yoga. I would answer the question, though, with at least 4 things that I could say could go across the board for all levels. And the first one would be for care because of the fragility of bones. And that would mean, first of all, to never ask someone to do in your cat and cow move, to look up at the ceiling and crank their neck like that. That's one thing. You don't do it any level or in any yoga, actually, either. Another one would be extreme care with twists, to always twist on an exhale. And another one that I think could be categorically throughout all yoga, whatever level, would be a balance between effort and ease. That there should never be a full an effort that is leading into the area of discomfort. And yoga for cancer shouldn't be so easy that no one is ever asked to exert. exertion is good. And I guess the other generalization I could say across all levels is use of props. We make great use of props. So this takes and allows yoga to be accessible at all levels. So those would be 4 modifications that I would say would be applied across all levels.
Fantastic. They only asked for 3. You gave us a bonus one. I deeply appreciate that. I think all of us will appreciate that. Also, who should participate in yoga, in oncology yoga?
Well, I think I'm going to take that one. So, so just to give Tari a break, but also I like one of the things that I love to do is do the research and stats. So 40% of the world's population will get cancer in their life. 40%. So if you actually look at the population right now in the world, that's 3.2 billion people. So in my opinion, that's who should be doing oncology yoga. And actually, the fun thing is, it's not my opinion. It's actually a recommendation. And it's actually the recommendation of the American Cancer Society. It's the recommendation of the CDC. It's the recommendation of the Department of Health and Human Services. It is the recommendation of almost every large healthcare organization. And they have come out in the last 15 years. I think the first study, which was the first cancer survivorship recommendations, was put out in 2014. So that was the first time it was ever, so just under 10 years ago. And they said that it should be a minimum that every cancer patient for every week, the rest of their life should be getting a minimum of 150 minutes of moderate exercise. And one of their recommendations was yoga. And one of their recommendations is an active yoga practice. So in terms of who should be doing oncology yoga, everyone. Yeah, everyone, the 3.2 billion people that will get cancer. And I don't mean to be light of that, because the reality, side note, reality is of that 40% of the world's population is that 70% of those individuals will survive. And part of the work that we do here, and part of the goal, is to help people manage the side effects and to manage that. And so that is really what we're trying to do, is help those individuals improve quality of life.
Thank you. I love that everything that you're sharing is so grounded in research and science. And so it gives more legitimacy to all of us as yoga teachers to share practices that are actually beneficial. Along that, you mentioned the guideline of practicing 150 minutes per week of yoga or physical activity. So if you had to determine the ideal length of a yoga class for an oncology yoga class, what would that be?
That's hard in today's world, largely because of the way technology and the use of online has changed the way, and the pandemic has changed things. But our recommendation starts with those facts and the science. If the experts say we should be getting 150 minutes, how do you break up that 150 minutes? And actually, a lot of the guidance has said that it doesn't need to be long sessions. It could be many 20-minute sessions. It could be 3 50-minute sessions. It could be 2 longer classes with a little bit of stuff on the side. But the goal is to achieve that 150 minutes minimum per week. And of course, just as a side note, we don't think that yoga is the only thing that you could do. Personally, I love to hike and walk and bike and ski and do other things. You can absolutely do those things. There's a reason we recommend oncology yoga play a central part in that management and in achieving those guidelines, because it helps on a holistic perspective that sometimes the other sports cannot, and other activities. But that would be my goal. So to set up a standard class in a studio, I would say minimum 50 minutes. Sometimes they can be 75 minutes. But as an individual, just doing 20, 30 minutes a day, it could be an excellent step forward.
Interesting point you made as well. It seems like consistency is key. right? Instead of doing 150 minutes in one day, as much as that might seem, it's more beneficial to have a consistent practice every day. And just tied to that, to the amount of yoga we practice, is there such thing as too much yoga, and how much is too much yoga?
Great question, Claudia. And another one that is really hard to answer, since we are not talking about a specific, we don't have a specific person or specific audience in front of us. We're making generalizations, but we have shared with you already, Josie shared the recommendations that we know from the American Cancer Society. So what is too much yoga? I can say from my own experience that 50 minutes of moderate yoga can be too much when you are undergoing treatments. What's important to understand, both the student and the teacher, is that treatments vary for every survivor, and treatment impact each individual differently. So, some days it can be a minimal amount of impact, and other days it's not so. It's you can be down for the count, or at least for that day. So the important thing is that we have in oncology yoga, we have modifications. We can both modify the class itself, the length of time, and how and where the yoga is done. We can do yoga in a chemo chair. It could be done in yoga can be done in a bed. So it's understanding that the goal is to gain all the benefits that 50 minutes would provide, but sometimes that's not possible. So as you said, Claudia, and I'm going to reinforce this, it's steadfastness. That's the key. The steadfastness to come back and do it again. Try again. Tomorrow I might meet my 50-minute standard goal, but it's coming back, and that's what is the most important part. Steadfast to the practice.
Thank you, Tari. And something else that came up for me as I was listening to you, the idea that it depends, right? We have guidelines, we have research, we have data, but then there's the human element, how you're feeling that day in response to treatments and how the recovery curve is. So definitely enforcing this self-awareness of what a person may need one day is completely different to what you may need the next day, and so forth. So
absolutely. I'm going to change. There's one that I know Tari likes this question because we get it often, and so I'm going to change track a little bit. So this is a question that we got several different people. It says, is oncology yoga or yoga largely used to reduce stress of cancer or to manage anxiety, or are there other benefits?
Well, as Josie says, I love this question because it leads into what I call the myths about cancer and myths about yoga too, but it's a myth-busting question. And it's so common. It's so common to think that would be that side effect of anxiety, which all cancer patients and survivors experience to some extent, but that is the only side effect that they experience from their cancer, and that is all that they would come to yoga for. That's all they would need or want, was to manage their stress and to reduce their anxiety. And as a survivor myself, I got to say that's a mistake. It's a mistake to lose all the other benefits that a full comprehensive yoga practice has to offer someone who is in treatment or recovering from cancer. I know when I was going through treatment, it was what I wanted most of all was to feel normal again and to be strong. I wanted to not feel sick and vulnerable. I wanted to get back to playing tennis and doing yoga. So I think that what the popular interpretation of what yoga offers is that anxiety reduction, and certainly it does, but there's a whole another aspect of yoga that is critical to one's complete and total recovery from cancer treatments and to maintain over a lifetime.
Terrific. I think that was excellent. And actually, can I say, side note, I think everyone would think is, I think that when you got diagnosed with cancer, the thing that you wanted to get back to doing, because you had won a cross-country ski race the day that you were diagnosed, that you wanted to get back out to go cross-country skiing. You wanted to recover from the surgeries, the chemo, the radiation, so that you could go back and win again, right? So it was beyond the tennis, and I just had that come to me. So another question around this, and I wanted to talk more, and Claudia already mentioned this, is everything we do in Yoga for Cancer is founded in evidence and research. It is the way that we operate on a daily basis, and it is based on the recommendations. It's based on the mounting evidence that has come from PubMed. It was funny when we first started this work. I started working with you just under 12 years ago, right? No, 11 years ago. When you would go on to PubMed, which is an excellent resource for any research, there was, I think, a couple hundred studies had been done on yoga and cancer.
Right.
Now I think we're close to 1,000. And many of those are actually using our protocols and using what we've talked about and using the teachers that we have trained. So I'm very proud of the work on that, but it is the foundation of everything we do. So here's the question, Tari. And in less than how many minutes, I think I give you 2 minutes for this one, is what is the science behind why yoga helps cancer patients heal faster and better?
Well, as that would take me approximately maybe 75 hours to answer, to define the science of yoga, and explain what it is and how it works in not just the body, but also in the mind. 75 hours is what I would recommend to answer that question. And that's what we do in the length of our training program. We give 75 hours to explain the science behind yoga. But essentially, what a cancer patient and a survivor, what our goals are to stay healthy as possible throughout, while undergoing treatments, and then to manage the side effects that come with treatments, but also to complete the treatments. And oftentimes those side effects can be an impairment to that. And then we have that's for during treatment, and then we have the long-term side effects that patients go into survivorship with, resulting from their treatments. And that is where the plethora of research, since I was diagnosed and was looking for answers, the plethora of research science has demonstrated that many of these side effects can be managed using yoga. And the overall health, excuse me, of an individual, the overall health of an individual can be improved through yoga. The research shows us, so we are very fortunate to be in a place to present an evidence-informed yoga practice that one can take as a survivor and one can give as a yoga teacher to those who come to us for help.
And I just want to lean into one of the things that you talk about there is, and you know, this is a doctor. If there's any cancer survivors, or if you've been heading into a surgery or anything, what is the number one thing the doctors say? Keep yourself healthy, right? Ensure that you are in the most best physical shape to manage the surgery, the treatments, the outcomes. And I think that's the one thing that we talk about quite often, and I know I'm going a little off track here, but don't worry, it's relevant, is part of what we like about this type of yoga and what is trained is about agency and about supporting someone and enabling them to take an active role in their recovery. And there's a lot, again, to go back to the science, it's called Dorothy Orum's approach to, I can't from paradigm or something like that. And it's basically standard of care. And it basically says that if an individual takes an active role in their care and helps themselves through the recovery process and helps them, they are going to have better outcomes. They will adhere to the protocols, they will do the physical therapy, and they will respond better. So I think that is another reason that we try to, that the yoga can be a very helpful companion to any type of recovery process. So sorry, I just interjected that, Tari. I know that.
Thanks.
Great points. As I was listening to you, Tari, talk about side effects, I remember during the shooting of the course and then watching the course afterwards, you did dedicate a lot of time talking about how to deal with some of the side effects of treatment. And so it's a question that's on a lot of cancer survivors' mind. But what exercises are the best for upper extremity lymphedema, especially in the shoulder area? And if you can explain a little bit about lymphedema as well.
Okay. All right. So lymphedema, I'm sure we are more aware of lymphedema now since so much research has been done on it. And it is a extremely common, but very serious and painful side effect of cancer treatments. Not just breast cancer, where it is most common, but other cancer surgeries can lead to lymphedema. It definitely will modify. Sorry. It can be very limiting to one's quality of life over a lifetime. And what it is a result of lymph system having been disturbed, wherever that lymph system might be. Most common, it happens in the upper body. Here's an example of where we use the science of yoga. We all know, of those of us who are yogis, how often and how much we use gravity. Gravity is something that we understand from science. It affects our bodies constantly and in a very, very powerful way. And we use gravity to strengthen our body. And we use gravity to move lymph through our body. We also use movement. So an example of yoga science is, elevating the arms into gravity, and then encouraging the lymph movement in the arms to relieve that lymphedema, which is the swelling, uncomfortable swelling of body tissues due to the lack of irrigation of the lymph system. So, it's the exercises to do this are quite simple, quite common, and call on the use of yoga science. And I think there are several very specific um, lymphatic massage exercises that we use in the short course that is on the Give Back Yoga program. So that's one way to deal with the way that common side effects affects the body. And as I said, it can be in the shoulders, it can be in the arms, but it happens in other parts of the body. And the similar technique is used, using gravity and using movement to irrigate the lymphatic system.
I'm going to jump in because I just saw another awesome question that's really specific about something that you talk about in the course. You talk about, I think, every time we ever talk about what we do, but it's definitely in the course and our certificate program. And I want you to go a little deeper and explain when you talk about the out breath being the vital tool to support the immune system. And can you explain a little bit more about that? Because you do talk about that a fair amount.
Okay. The out breath, the exhale, that particular part of a breath. The breath consists of breathing in and breathing out. It's that out breath that actually strokes the largest lymph vessel in the body, and it strokes that vessel up towards the thoracic duct because it is moved by the diaphragm. The diaphragm, as we all know, is a horizontal muscle that connects to the bones of the rib cage. And the diaphragm actually in between, I'll do it over here where I have a little bit of shadow. The diaphragm, this is the diaphragm. And it actually, through that diaphragm, the largest lymph vessel heading towards the thoracic duct exists. Okay, so when the diaphragm moves down that vessel, down the vessel of the lymph system, that's an inhale and it moves downward. When you exhale, the diaphragm moves up. And some people don't quite understand that dramatic directional quality of the diaphragm, but in its doing so, it strokes the lymph vessel and irrigates the lymph system. Now, so that's one way, one really big component of how the breath, how the exhale functions as sort of the garbage disposal of our body. When it moves up on the exhale, not down on the inhale, but up on the exhale, it is our garbage disposal. And then other ways that upward movement in the chest area, that upward movement also activates the parasympathetic nervous system, which sets us up for the relaxation response. So that's a second way. That's a second way that that the out breath supports the immune function. And again, research has been done on this on the out breath, and has shown that it actually an extended long exhale creates the relaxation response. They've researched that and demonstrated. I mean, you can do it on yourself. Just start with an equal breath, inhale and exhale, and then on yourself, begin to count longer on the exhale, equal on the inhale to where you started, and the exhale gets longer and longer as you sit and breathe. And till the point where your exhale is double the count of your inhale. And then stop and just feel the sensation of relaxation, fill your body with that extended exhale. So, how to support the immune function? Well, take an out breath.
I love that. At least, this is just episodic, it's just me, but deep exhalations are my best friends, especially moments of activation of the nervous system. Even when I can't fall asleep at night, I just focus on lengthening the exhale, and it's quite powerful. So thank you for sharing that. And going back to the physical movement, the asana, the physical part of yoga, are there any weight-bearing exercises that are necessary in addition to a yoga practice?
Okay, well, in oncology yoga, weight bearing is an integral part of the practice. It's not as well known, but it is true that one of the most common side effects of cancer treatments is bone loss. Hair loss, okay, we know all about that, but not everyone knows that bone loss is a significantly common side effect of cancer treatment. And we also know from science going way, way back that weight bearing has long time been used to manage bone and also muscle loss. This is not new news. So why do we not put it into our yoga practice? Well, we do by using weight bearing poses. So, it's bone loss as a serious side effect of cancer is far more risky than losing your hair. And we have ways of dealing with it. And we can do weight bearing. We can do it in a chair. We can do it with all of the props. As I say, using props in oncology yoga is integral part of it. But it's a necessary part to put weight bearing of some form into our oncology yoga practice.
Tari, I'm going to tackle another question, and it's a little bit different in scope, and it's about how do you design a practice for someone with cancer who has no experience with yoga?
These are our prime candidates. There is nothing more ideal than a patient or survivor coming to an oncology yoga class who's never done yoga before. They start with a fresh, open mind, and they've probably heard the very common phrase that yoga is good for you. They also come highly motivated to advocate, as Josie has said, to advocate for themselves in their recovery process and long term, because they come very hopeful that yoga will make them stronger, healthier, and help them be able to manage some of the side effects of yoga. So when people come to yoga for cancer without any yoga experience, they're coming with lots of anticipation and hopefulness, and certainly this is the kind of hope we want them to have. Hope that they can change their lifestyle and with that become healthier to avoid a recurrence, which is probably more anxiety producing than their original diagnosis. Our particular form of oncology yoga is adaptive, it's progressive, it's safe and effective, and it's designed to meet the needs of whatever body size, shape, or flexibility and strength, and also whatever activity level that person brings to the oncology yoga class.
Great. We have another question for you that has come from someone, a teacher in Uganda has written in and said, in Uganda, there's so many people with cancer. How do I engage them in the practice, especially when Ugandan doctors don't even know what yoga is, nor understand the benefits?
Mm. Wow. Well, first of all, I'm thrilled to have you join us if you are on this call, and thrilled to have you present us with such a question. This was the reality I was faced with also 20 years ago. The skepticism that was not only the skepticism coming from patients and survivors, but skepticism coming from the medical community. And I want to start with saying that even though you are whether you are in Uganda or California or Vietnam, this is a common, serious challenge that we all need to address. And we need to be able to encourage survivors to participate in oncology yoga. How to do that? Well, I would say start with the facts about what yoga can do, start with the science of yoga, explain the many, many benefits that a yoga practice has, and the benefits that are real concrete, evidence-based and evidence-informed ways of dealing with side effects, and also how yoga will support their treatments and make their treatments more effective. You can work with local groups. You can go to the doctors themselves and try to create a partnership with the doctors in the hospitals, explaining to them how the yoga will help manage the side effects that the doctor's treatments are necessarily eliciting and causing in their patients. And the doctors themselves may be frustrated with how to manage some of the side effects. We have good, solid evidence in the white paper of the kinds of research that has been done to show the benefits of a yoga practice to those who are being treated and those who are in long-term survivorship. So give your potential students and give the doctors a copy of the white paper and discuss the science and the benefits behind the yoga.
Great, thank you, Tari. Another little bit of a different question for you. How do I support, this is from a teacher, how do I support students to grieve when one of their class members has passed away? How do I help them manage their own fear and stay positive and motivated?
This is an unwelcome challenge to yoga teachers, to oncology yoga teachers, but an inevitable unwelcome challenge. It's not only the class member, but it's also the teacher who is who's asked to face this reality. And all I can say is that it requires conscientious self-care. Setting self-care is a priority and a necessity. We have many tools in yoga beyond weight-bearing exercises and warm-up exercises. We have other tools such as meditation and the tools of self-awareness. And these are vital elements of an oncology yoga practice. We practice this and discuss and talk and study how to include these things in an oncology yoga class. throughout our training. It is a question of self-care to do so, and we do, not to be avoided. Thank you for asking that question also.
I know that's a hard one, and it's an unavoidable one.
And it's also one of the areas in which it's sort of like we must be careful about presenting yoga as something that is going to cure. We are not offering yoga as a cure. We are offering yoga as a way to find condolence in our ability to be self-aware and to sit. This is what I always say to my students: how are you able to sit with your discomfort and your fear?
Oh, Claudia, I think you're on mute.
You would think by now I figured Zoom, but no. I was just saying this is such an important point, especially for a lot of yoga teachers holding the space for everybody to process and go through the practice however they need to. So what would you recommend for anyone who's a registered yoga teacher, how to use the knowledge acquired through normal teacher training, 200 hours, 500 hours, along with the oncology yoga training? How do you use the two knowledge to be a more effective teacher and then ultimately don't hurt anybody in the class?
Well, a RYT level of yoga training is sort of like, well, it's very empowering, and we feel after we graduate and get our college degree that we have the power, and that's true. It is that, but it is only the college degree. To practice and to properly understand oncology yoga, that is basically the PhD level of being a yoga teacher who is meeting the needs of cancer patients and survivors. So I would say that we are needing additional training, and that's the same as if someone were to graduate with a Bachelor of Science degree. You wouldn't necessarily be a doctor. You would go on to specialize, and that's sort of what we are trying to create here in the Give Back Yoga University, is a specialization in to get your graduate degree in teaching yoga for cancer is critical and very, very important. It is beyond what you are going to be covering, the understanding of how treatments affect the body and how the science of yoga can really address the side effects and the needs of a cancer patient and survivor. I don't know, Claudia, did I answer that question?
Yes, you did. Absolutely. And if I had to distill it, as a RYT, you don't have all the tools and the knowledge necessary. So additional specialization through the short course, but also through the 75 hours course certificate, it's fundamental, necessary, and paramount to really serve cancer patients.
I would interject that most RYTs don't talk about cancer at all. Yeah. Most RYTs have a very base level of anatomy and body functionality. Most therapy programs do not. have a focus module. That's where we partner with therapists around talk about cancer. So it is, I mean, it's truly, you know, I have to have surgeries, I want them to have practice and understand exactly what type of surgical intervention that I need. We've kind of tackled most of the questions that we've submitted. We have a few other looming, but I also want to address one that we just got in the chat because, excuse me, from that we often answer, and it's a good question that we could have fed in. It says, so Tari, I'm going to ask this to you. Are there postures of any that each kind of cancer, so breast, lung, prostate, may benefit, or also are those that are not recommended? So do you recommend postures for specific types of cancer and or those that are counterindicated? Or
Well, as I said in the beginning, oncology yoga is a comprehensive practice from beginning to end of the kinds of elements it includes in what we would call a complete 50-minute practice. And what is ground basing, the basis of that is all of that, those elements of a practice are addressing how to keep the immune system strong. And whether it's prostate cancer or liver cancer or brain cancer, that is the overall goal, is to keep the immune system strong. So what I would do for someone with any one of those very separate and very different cancers would be very similar kinds of things. Pranayama practices that do actually encourage the immune system to function better. Weight-bearing exercises that actually do build bone, because any one of those three separate cancers, a patient is likely to suffer bone loss. So there's a universal quality to the kinds of things that a cancer patient and survivor would need. Now, there are specific things to say, particularly breast cancer, because that is one of the cancers in which there is more obvious and also expected loss of range of motion because of the surgeries involved. But any of the kinds of things that we do in a standard oncology yoga session to increase range of motion is beneficial to someone who has liver cancer or brain cancer. There's no harmful effect at trying to increase your range of motion. So the benefits run across all of them and are inherent to the actual increasing our immunity. I would say, and I appreciate the mention of, are there things that you do not recommend? And I would say probably there is one specific thing that I could say across the board, all levels, that we are saying is a no-no, and have, first of all, just don't do it. If you feel that it is somehow involved in something that you are teaching, modify it significantly, understand it. And that is deep forward bends. Deep forward bends with the rounding of the spine, not a flat back and a fold, but a deep forward bend, compresses the chest so that you are not breathing properly and endangers the very fragile vertebrae bones in the spine. So across the board, that is one I would say avoid. Be really careful, as I said in the beginning, of what you do with your neck when you are doing a cat-cow movement, and look forward to lengthen both sides of the neck and the front and back. Look forward not up at the ceiling, because that shortens the back and lengthens the front, which endangers the vertebrae also. So caution with everything. I mean, and it might be, oh, she's going to say, don't do inversions, don't do that. There are other, well, quite honestly, a deep forward bend is far more dangerous than an inversion. If you can teach an inversion carefully and safely, hey, lots of strength and bone building can happen. So I hope that answers the question.
It absolutely does. And I want to add to that, because we talked earlier on, and you used this word codification, which we use and we talk about. And the person, we're asked this all the time: give us your top 5 poses for breast cancer, give us your top 10 things for prostate cancer, because it's so easy. It's just impossible to answer, because the reality is, first of all, what we're trying to do is address the underlying symptoms that are coming out of the treatments. And most of those treatments are universal across all different cancer types, but some are not, right? Some people don't get chemotherapy, and there's thousands of different types of chemotherapy. People think that chemotherapy is one thing, it is not. Some people react to chemo in different ways. Some people react to radiation. Radiation for brain cancer is different than radiation for breast cancer, which is different than radiation for prostate cancer. So what the part of the problem is, and it's a common question of, can't you just give us the top 5 of this? And if we do that, we are not only undermining what the individual really needs, and we're actually undermining what they are potentially going for. We're undermining what the benefits and the yoga needs to do. So I go back to one of the things we first talk about in any of the programs that we work on, is this need for critical thinking, because we need you to understand not just understand everything that you possibly can about cancer's impact on the body, and how yoga can support that, and how the science behind yoga is broken down, not this kind of amorphous things, but also what the individual is going through. And it goes back to something that Tari talked about earlier, is just because someone gets a cancer diagnosis does not mean that their diabetes goes away. It doesn't mean that their other underlying health issues don't play a part. So where that individual is, if they're a 30-year-old, or if they're a child, or they're a 70-year-old, male, female, anything, those are underlying things that you must understand. So using those 3 things to create to critically think is a penultimate requirement to be safe and effective. And for us, that is the foundation of being a truly effective, a safe oncology yoga teacher. But all that information, you don't have the tools to safely support. I am mindful of time. It is 12 o'clock. We tackled a few that we got, and we tackled a big chunk. But as I admitted in the beginning, we were not going to get to all the questions. There's going to be, and I know some people joined late, and I know many people were going to attend the replay. So you're going to get a copy of the replay once this is done. And then importantly, in that email, we're going to give you lots of documents for you to review, videos to watch. And most importantly, we encourage you to take this as your first step forward. If you have not received any type of training, I hope we gave you some of the kind of, oh, I need to do a little bit more foundation work around this. And we're going to give you 2 opportunities and discounts to participate and deepen your experience, both in the short course, which is 5 hours, which just gets you started, and then the 75-hour course, which is a full certificate. Of course, the 5-hour course cannot do what we do in 75 hours. The same thing, this 1-hour webinar could not do what either of those do. And then just stay in touch. And it's important work, and we need all the help from. There was submitted from Uganda, Turkey. I mean, we had the Vietnam, Australia, South America. Tons of people registered for this and participated. So we welcome and encourage you to participate and have this be the first step. Tari, I know that you wanted to do a little bit of a closing.
Yes, and it will be just a little bit. Thank you for joining us. And if you did not join us, thank you for watching and listening. And please, at any time, send us your questions. Actually, I have only two things to say. I hope we have ignited your curiosity and interest. If you have not been trained in oncology yoga, I would hope you would venture down the path of getting that graduate degree as a yoga teacher or a yoga therapist. And then I want to just end with a quote from Mr. Iyengar. Very applicable to the intentions of what we are all gathered here to explore. But actually, he didn't know it when he said this. He was not addressing cancer. And in fact, he was not addressing any particular disease or disorder. But he did offer advice to his students who were intending to help others. And he said, and I will quote slowly, "Do not imagine that you already understand and then impose your imperfect understanding on those who come to you for help." So I hope you will join us in one of our trainings, and thank you again.
Bye, everyone. Thank you very much.
Thank you.